Expectant and Parenting Youth in Foster Care Learning Collective and CSSP. We welcome you to our second webinar. Today's discussion will focus on creating opportunities for expectant and parenting youth and their children through a co-parenting approach. During this webinar, we invite you to connect, share ideas, and challenge each other's thinking. Our presentation will begin shortly, but first, some important reminders. We will be recording the webinar. We'll send you a link to view the recording at following the webinar, and it will also be posted on our website. We recommend that you use a landline to listen to the webinar, and if you do experience any audio problems, try hanging up and dialing back in. Due to the number of people online, all attendees are in listen mode only. You can submit questions at any time using the chat feature in your control panel. We will be holding question and answer sessions as well as a peer discussion session at the end of the webinar. At that time, we will unmute individual participants. To signal to us that you want to ask a question at that time, click on the hand icon in your control panel. This is, as you can see, this is our team here at CSSP. My name is Lisa Primus, and I am the top center with the big, beautiful earrings. And I am joined on the webinar today by my colleagues, Teresa Becky, who is directly underneath me, and Sarah Morrison, who is to my right. So here's what we hope to accomplish today. We hope to describe co-parenting, really define what it is and how it can, why it's important and how it can lead to well-being outcomes for both the expectant and parenting youth as well as their children. We will also be hearing and learning from the lived experience of two young parents as they share with us how they are currently co-parenting with the mother and the father of their child. Following that, we will learn more about the Young Parenthood Program, which is a co-parenting counseling model that was specifically designed for expectant adolescents and young adults that has been implemented and evaluated. And then we really want to have a peer-to-peer discussion. We want to hear from you about what are the strategies that you're implementing around this approach. What are some of the ideas that you have, as well as what are some of the questions that you have of other folks that are on this call. To help us in accomplishing this agenda, we have three dynamic speakers, and I'm just going to quickly introduce them. So our first presenters are two young parents, Isis and William. Both are working as consultants with the New York City's Administration for Children's Services Young Parent Speakers Bureau. The Young Parent Speakers Bureau was developed to facilitate peer mentoring among expectant and parenting youth in foster care, and as a mechanism to solicit and incorporate youth voice into policy, program, and practice. Our second presenter is Dr. Paul Florsheim. He is a professor and clinical psychologist at the Zilber School of Public Health at the University of Wisconsin-Milwaukee. He is the principal investigator for the Young Parenthood Program project, designed to test the efficacy of a co-parenting counseling program for expectant adolescents and young adults. Welcome to all of our presenters. Before we move forward with our presentation, we want to take a few minutes to share with you a very brief overview of the theory of change that CSSP has developed for improving well-being outcomes for these young families. I will go over it very quickly. For more detailed information, you please go to our website at www.cssp.org. There you will also find a recording of our inaugural webinar that discusses our theory of change in great detail. Our theory of change is informed by both research and practice. It draws from and combines two initiatives at CSSP. Strengthening Family, which is focused on how parents can be supported to be successful, and Youth Thrive, which is focused on how adolescents can be supported to thrive and successfully transition into adulthood. Our theory of change is reflective of the need to support expectant and parenting youth, not just as adolescents, not just as parents, and not just their children, but as a family. We intentionally use the word expectant to be more inclusive of fathers and to underscore the importance of father engagement and involvement. As you can see on the slide, the results that our theory of change hopes to achieve are thriving youth, that youth have educational success, strong and stable connections, and are physically and mentally healthy. And that as they are thriving, they are better positioned to become nurturing parents, that they are able to create and maintain an environment where their children are healthy, safe, and ready to learn. In order to achieve these results, we believe that any approach must have several key elements. And you can see those elements listed on the slide. The elements are that the approach must be multi-generational, that it must be developmentally informed, trauma-informed, multi-systemic, youth-driven, results-based, and informed by evidence and practice. In addition to these key elements, we believe that the strategies must build protective and promotive factors by both creating opportunities and reducing risk. We strongly believe that both are necessary. To help youth thrive, we think of creating opportunities for school-based support, financial literacy, and constructive community engagement, while at the same time implementing strategies that reduce risk, such as trauma screening for all youth, BB support, and family planning services. To help youth become nurturing parents, we think of creating opportunities for home visiting, parent-child activities, and co-parenting support, while reducing risk by providing early remediation of developmental delays for their children. Our theory of change emphasizes, again, the need for strategies that mutually create opportunities and reduce risk so that these young families can succeed and thrive. Our presentation today will take a deep dive into creating opportunities through a co-parenting approach. So we're going to begin by looking at the definition of co-parenting. This definition highlights a number of key themes that are important to the concept of co-parenting. First, it emphasizes shared decision-making and support between parents and caregivers, all of which are focused on the well-being of the child. It also calls out the link between the quality of the parents' relationship with each other to their child's development, how their relationship impacts their individual parenting behaviors and interactions with their child. Essentially, co-parenting is really about promoting a child-focused relationship with the ultimate goal of healthy development and well-being for the children. So now let's take a look at why co-parenting matters. A number of research studies have examined the influence of co-parenting on child well-being. The findings suggest an increased likelihood in the outcomes that you can see on the slide for parents, reduction of parenting-related stress, parental efficacy for children, socio-emotional well-being, healthy development, and reduction of behavioral problems. Parents who report shared decision-making and support tend to feel more confident about their parenting abilities. And as a result, they feel less stress about parenting, all of which lead to improved well-being outcomes for their children. So some of you may be thinking, co-parenting is such a great approach. How can I implement it? And so it's important at this time to note some of the hurdles that must first be cleared. While there are a number of evidence-based and informed programs that focus on parenting, education, and skills, there are very few that focus on the skills that are relevant to co-parenting, such as interpersonal skills, communication, and problem solving. Those that do tend to focus on older couples, particularly those that are divorced. And we all know that the issues facing adolescent parents are very much different than those experienced by older adults. Additionally, few curricula are available that specifically target expectant and parenting youth. We will have a chance during the peer-to-peer discussion later to hear from New York City's Administration for Children's Services about a co-parenting curriculum that they have developed and will be piloting in July. Another hurdle to clear is the recruitment of young fathers, which could be attributed to the difficulty in obtaining accurate contact information for them, as well as general engagement efforts that often don't invite them into their role as parents. During the peer discussion, we really look forward to hearing your ideas about clearing these hurdles, as well as learning about what strategies you're currently implementing. We will now directly hear from two young parents, Isis and William, and I'm going to start by asking Isis and William to introduce themselves.
Hi, my name is William Branch. I'm 22. I have 3 children, an 8-year-old daughter, a 6-year-old daughter, and a 3-year-old son. And I'll be attending college this fall to BMCC.
Hi, my name is Isis Patterson. I'm 18 years old. I have a 3-year-old son, and I'm looking forward to attending Endicott College in Beverly, Massachusetts this fall.
All right, thank you both for being with us today. So I'm wondering if we can start by asking you to walk us through your journey of establishing a co-parenting relationship with the mother and father of your child. And if you can highlight for us, when did your co-parenting relationship start? Was there a moment where it clicked naturally, or did it take time? What were some of the challenges that you had to overcome, and how has it developed from the beginning to now?
So I guess I'll start. It's Isis. The co-parenting relationship really started for me as soon as I became pregnant, and once me and my child's father made the decision that we were going to keep the child, that's when it actually came into play. Going to doctor's appointments together and making decisions that were in the best interest of my pregnancy was actually when we started parenting and individually. And such parenting often required, co-parenting, of course, making arrangements and decisions on what would be best when we were to have our child. There were many moments where it didn't naturally click. I mean, it was very new to us. We were both young parents as well, and we didn't have a type of icon that could have showed us exactly how to go about such a situation. It was usually looked at negatively in my pregnancy due to the fact that I was young, but we had to take the initiative together as young parents to try to be an icon for ourselves. So moving on forth, as we began to mature more and spend time with ourselves to really realize the decisions that we're making, to be able to say we are going to have this child, it started to click. We started to understand why it was necessary for him to come to my doctor's appointment. It was necessary for him to understand that as well. Especially being being pregnant with this child, like, you feel that it might be different because the child's not here yet, so you might not have to go to the appointment. But as we spent more time understanding such a big role we were about to take on, it was absolutely necessary for him to accompany me on such appointments and on forth. Again, we went through many challenges that we had to overcome due to the fact that it was a lot of negative perspectives looked at. My pregnancy was looked at from many different negative perspectives, and we had to overcome that often because as much as it was looked at negatively, we had to change our lives for a positive reason that would be in the best interest for our child. So that was a very big challenge that we have overcame. And from then to now, we definitely developed into a strong co-parenting relationship. I mean, there were many emotions there that you also have to overcome in a relationship, because that's how parenting starts. You know, there's the intimate, romanticism type of relationship prior. And, you know, we overcame those challenges and the tensions and the resentment and things that we had prior. And such development and controlling it so that we can be a positive resource for our child has definitely improved.
This is William. As far as I'm concerned, I told her that I wasn't ready for the baby, and she kept the baby anyway, thinking that it would keep me involved with her. But I left when the baby was first born, because I was 13 at the time, and I was still young, and I wanted to still have fun and, you know, be a kid. So I guess that's when immaturity took place, and I was just like not really comfortable with having a child. But I was the only one she had, so I decided to go back and step up and do what I had to do as a father. My mom helped a lot, and, you know, I got everything the baby needed. And I knew, like, once I realized that, you know, she was the only one that, you know, that was taking care of the baby, I had to step up, because I didn't want my child to be in the same predicament I was in when my father left. It wasn't a lot of, you know, discipline as far as someone helping me with homework or just someone being there to talk to as far as a male figure at that time. After the second child, my daughter's mom went into foster care. That's when the co-parenting relationship developed. I was there every chance I had, because my father wasn't there like that, and I didn't want my kids to go through the same thing or the same process of, you know, the emotion that was built up and the questions that, you know, aroused at a certain point in time and becoming a man, you know. I realized I was 13 and I had to take care of my kids. And I definitely didn't want to leave my mother with that responsibility. We've been co-parenting and working together to pick them up, provide and work out for the best. My kids are very smart and they grew up well. So, you know, they catch on to a lot of things. And one thing I didn't want them to try to put together that their father wouldn't be there. And as far as overcoming challenges, I mean, the biggest challenge for me was realizing that I'm a young father who has a very important role. And regardless of the limited resources or lack of information I've had, I still had to do what I had to do for my children. And now we're at a point in our relationship where my kids know who I am. They see me all the time. They open up to me. We talk all the time. I take them to school when I can. I take them out. So it's a very good relationship.
Thank you. Who or what helped you the most in establishing and maintaining a positive co-parenting relationship?
This is Isis. A lot of factors influenced it. Number one was, of course, our child. In developing and making sure to establish and maintain a co-parenting relationship, he definitely influenced that. Like William had said prior to me speaking now, you don't want your child to go through the same predicaments that you went through, especially experiencing not having both parents on the same page, not having two parents understand, making decisions that are in the best interest for you can really tear an individual apart, and we didn't want that to happen to our child. So our child definitely influenced us to maintain a positive co-parenting relationship, regardless of the fact that it was hard, because as we progressed over time and developed our relationship into a strong establishment of such a co-parenting, we've realized a drastic change in my child's behavior, in his social skills, fine motor skills. He was just stimulating in the best of ways. And also another factor that helped us to establish and maintain a positive co-parenting relationship was the fact that me and his father didn't have an immediate model of who are co-parents. You know, such a term, co-parenting, was very new to us, but we knew it was a skill that we had to attain. We just didn't know where to start. We didn't have any icon, we didn't have any model, and we were often discouraged because of our age. People always looked at our age, like, you can't do this, you can't make this possibly work. No. So we were very determined to be our own role models and to continue on in creating this co-parenting bond. Because separation was taking a toll on our child before, when we were going through a stage of, stages within ourselves, trying to make peace within ourselves so that we can make peace with each other. It was really hard for our son. Not seeing his father was difficult. His father was going through a time where I guess he started to soak a lot of things in, and it was very different for him to accept the fact that he was actually a father and the child's there and needs his physical help. So there was an absence from him for a little while, and reflecting on that and trying not to mirror those same experiences that he had as a child with his father, and not wanting to mirror that within his son, really helped us to continue on this bond of co-parenting, and that's why it is the way it is today, which is great.
For me, who helped me was when the mother of my daughters first entered the mother-child program, the staff was open to me spending time with my daughters, which was really a wonderful thing because they included me in dinners, and they used to go out on trips, and they would always offer me to go. And I guess those moments, especially on the trips with my daughters, can really look back and have the most fun. They can see that I was there. And as well as that, I was introduced to Claremont Neighborhood Centers, which was a fathering program. I had two mentors there who really helped me cope with the fact that I was a father of two, and that I'm demanded to be there to take care of my children, and that two parents is better than one. They constantly reached out to me and answered the phone whenever I called, whether it was 4 p.m. or 3 o'clock in the morning, which was actually what I needed as far as not having a father, because there's questions that popped up in your head at the weirdest times, and you have no clue, and then sometimes it just goes away, and you don't know that it impacts you emotionally until the question come around again, usually, which is too late. They also helped me with car fare to get to work, and the foster parents of my kids, they really had a different style of discipline and how to talk to them. And it was weird because I'm so used to getting uptight and being so uptight that that's the only thing I knew how to do. But there were certain methods they used that really helped me in a way to really talk to my daughters and make them understand and have them express themselves with words as opposed to me yelling and screaming, and asking them the right questions so they could rethink about what they've done. And later on, it really worked when I applied it. So I think, as far as my mentoring program and the staff of the child program and my children's foster parents, well, not my children's mom foster parents, I think that really helped me in the process.
Thank you. Can you share with us some specific examples of co-parenting agreements that you have made with the mother and father of your child?
So she had another baby by someone else. Co-parenting was already in place, but this was like a whole nother level of co-parenting. And it was new to me, and I was shocked and frustrated, but everything that that fell on me, I really didn't mind because I've been doing it for so long. So I decided, because the girls was living with her the whole time, I decided that I will take the girls and bring them to school and pick them up, and she could see them on the weekends and for the time being, so she'll have time to, do what she needs to do for the baby. Because I know having 3 kids, a newborn, and then children who have to be to school early in the morning, it takes a real toll on someone, especially a mother who's, been in the system for a very long time with the kids for a very long time. Even though I was always there, for me, it was never enough, So I decided to take the girls for her and take them to school every day, pick them up, and she could just see the kids on the weekend, and we agreed to that, and it works out perfectly.
School was a big issue for me, which was something that our arrangements revolved around. I was a high school senior. I was in high school during majority of Caden's toddler age, and I had to be at school early, and I couldn't do it exactly on my own. And with that, it demanded his father's help. So some specific examples of the arrangements that we made in regards to the co-parenting on that certain subject was that we agreed that 1 to 2 times a week he can take Caden to school during the morning for certain school meetings or school commitments that I had to make. And of course it was hard for him at first because he's not with Caden 24/7. So waking up at a certain time, especially early in the morning, was really difficult for him. And he lived in a different neighborhood, which was farther away from Caden's school. So it also demanded a lot of time management, making sure that he got there on time and time planning ahead of time. So it was a lot of skills that such a almost simplistic type of arrangement demanded for him. But I stressed that it was really important, and being to school on time would of course affect my attendance and whatnot, and my attendance would further affect how certain colleges would look at me. And my goal was to get into college, and which I have with such arrangements being made. It was progressive, and he's seen such progression. The best thing about developing such arrangements is to see if those arrangements were effective. If those arrangements were effective, then it'll prove to both parents that they're doing something correctly. And that's exactly what happened with picking up Caden 1 to 2 times a week. Just something so simple like that. It really helped me personally. It helped him with skills, and of course it helped Caden. Telling my son that he was going to be picked up by his father at a certain day gave Caden a routine. Caden's my son's name. Gave Caden a routine. And it allowed him to also trust us. Being able to tell my son that he will see his father today allows him to trust me that is true. And to trust me, he also trusts his father because his father does show up. So you want to make sure you have that relationship with your child, that trust. And co-parenting definitely does help to establish and maintain such a positive relationship with you, the child, and the co-parent. So arrangements is a big theme, is a big focus amongst co-parenting, and school was that big issue that we positively arranged.
Thank you. In what ways has co-parenting helped you personally, and how has it helped your child?
It really has helped me, helped my kids, because a while back they were having some behavior problems at school, and this was surprising to me because my daughters was the leader of the class. They was they were scholars, basically. That's what they call them in there, and they had good grades. It came to the point that the school and the foster parents gave me a call and said that the kids, me and my kids' moms arguing was affecting the kids' behavior in the school and their ability to learn. Through my mentors, I realized that our arguing wasn't about kids, but about us. And I reevaluated my thinking and how I reacted to things that happened between us. For example, I was upset when another boyfriend had entered in the life of my children's mother because I felt like she was trying to let him take my place, and I was scared for my kids not to basically love me as much as they did, and I was basically feeling like my efforts wasn't, enough, or like it was just irrelevant, like it didn't matter. So I had been afraid of change, but being there for my kids, I took a step back and learned to cope, that I'm not going to be the only man in my lives. It helped me within myself to know that I have the confidence and the potential enough to know that my kids understand that I'm always going to be there for them and I'm always going to be number one in their lives. Once I really understood that and, set my own feelings aside and really compromise with my kid's mother and stop arguing all the time, their behavior got better, and not well as their behavior, but mine as well. Me dealing with certain things I can't control, certain things that always gonna pop up in life. I dealt with in an effective manner that my kids will see that that I'm handling the right way. And when I finally realized that, and I realized that through my kids, they always used to call me a superhero because, of the way I react to things, the way I would handle things. So it was a good experience.
Co-parenting has helped me and my son, like I said previously, to establish trust and a bond with his father. Being able to arrange certain dates and to be able to schedule meeting times for him and his father really allowed my son to trust me, that I wanted such a relationship between him and his father. Of course, my son probably couldn't really appreciate it to me using his words, but his feelings definitely allowed him to understand it. Also, financially supporting it was a big factor in helping me personally. Of course, it is a big factor. Being financially stable is a big factor for any situation, but co-parenting importantly as well. But even though that's a big factor, physically being there for my son and showing his support is more than anything, is more than any money. It's what children need to grow, and that's definitely what was shown to my son, and which really helped him stimulate drastically, was definitely us both physically being there for him, showing him that love. But not even, two parents can physically be there for their child, but still have some negative tension. We were there for our child, physically being there and showing positive relations toward each other for the best interest of him, what he needed to see. And that's just a beautiful feeling for these children growing up in a world they are helplessly born into, and giving them that advantage to at least be happy during these years of their lives, early years of their lives, helped him to grow. And I always focus on that, Personally, co-parenting has helped me to get the child care support that I need for me individually and, of course, my son. And I also just want to stress that co-parenting is always in the best interest for the child, but along the way, it'll be in the best interest for you as parents as well.
What tips would you give to other expectant and parenting youth about co-parenting?
I would say be at peace with yourself before you start engaging in co-parenting. I know that it sounds like, wow, co-parenting is this really great thing. It's such a benefit for the child. It's such a benefit for the parent. But it won't be beneficial if you're trying to jump into something and you're not at peace with yourself. When I say at peace with yourself, I'm probably not talking about yoga or anything like that. But what I'm really talking about is being able to prioritize things, to be happy in the priorities that you have, to see that they're effective, resourceful priorities for yourself and your child, That's what I mean by peace. And this is something that both parents should be doing, especially if you're both trying to engage in a co-parenting relationship. And it'll definitely show along the way that it'll help you easier. You know, it'll just flow right through if you're definitely prioritizing things correctly. And you'll be more confident that you can maintain and establish, moreover, a co-parenting relationship. So I definitely want to stress that as a tip. Also, when you make the decision to keep the child, it gives you time to grow individually. So co-parenting should be started early, or being at peace with yourself should be starting as soon as, I want to say, conception. It also takes, I'm sorry about that, it also takes time and patience, so be ready for those. They're very tedious skills that we need to apply in our daily practices. So it definitely takes time and patience, so be ready for that.
I would say compromising is actually a big key in co-parenting, especially with minor decisions such as financial things. You know, you and your partner might not see eye to eye on a stroller, and, you know, it decides to become a big issue, and, you know, now you're arguing over what's the best stroller and what's the most expensive and the most nice. You know, it can turn into something major. Also, preparing yourself for situations you can't control, which is like, I'm a father, I'm looking for what's cheap, you're the mother, you're looking for something so nice, you don't even care about the price, but the price I see is way more than the price I was looking at. You know, it's no win, you know. If that's out of your control, you got to be the dad and get whatever mom wants sometimes, you know, even though you think it's irrelevant. It's still something you need to let go. It's not that serious that you're the provider. That's something you have to do. And put your thinking cap on and figure out ways to fix it. Give up the fact that you think it's about you anymore. That ended when the egg and the sperm came together. I really think it's about the child or the children. All the personal and anger, just put it aside and focus on being the best for that child. It's going to take time, of course. It's not a walk in the park, but you got to humble yourself and do the best you can. And don't give up, because trying hard is definitely something that will prepare your kid in the long run. That shows them that you never gave up. So, you know, that they say that your kids don't listen to what you do. What they see you do, that's what they want to do. So trying hard would definitely will allow your child to apply that to their lives. So.
Thank you both. And finally, what recommendations do you have for professionals working with Expectant and Parenting Youth around creating opportunities for co-parenting?
I would say explain the benefits of co-parenting to them, the importance of developing a sense of compromising or working together. Let them know the benefits, or if you can, let them see the benefits of co-parenting, and as well as explain in detail so they can get a better understanding. Create more opportunities for fathers, like my daughter's mother program did for me when they, you know, invited me to dinner, invited me to brunch, and invited me to go out and take the kids out to our playland, to the park, and pick them up from school. That was the best experience I've ever had personally, because it allowed me to show my daughters that I put it in my best foot forward to be there for them. As well as the mother-child program was an experience of a lifetime, because that was my real first lesson in being a father. It wasn't just about financial-wise. It was about my kids knowing I'm physically there. So if programs can and people who work with EPY or work for EPY just get fathers more involved in activities and have them see the benefits of the co-parenting piece.
I would also say get Expectant Parenting Youth perspective when working with them. A lot of professionals tend to sometimes be stubborn to some new and effective ways to approach co-parenting. So definitely be open-minded to to different and new ideas on co-parenting. Hear Expecting and Parenting Youth voice, get their voice, allow them to speak on certain subjects. Don't be narrow-minded towards the sex either. A lot of times more mothers get resources than fathers, so also be open to the father's perspective and whether the father really wants to be there or just can't be there due to their financial incompetence. So definitely be there for the father, both of the parents. Try to understand both parents' sides and try to incorporate that into practice and policy as well. Not being narrow-minded to the sexes in parenting. And that's my advice for professionals working with EPY.
Thank you very much, Isis and William, for sharing your experiences with us. I found this discussion very illuminating and insightful, and really about what it takes to co-parent and the benefits that it can have not only for you but also for your children as well. At this time, we're going to take a couple of minutes to open it up to see if anybody has any questions or comments. You can select the hand icon in the control panel and we will unmute you. Are there any questions or any comments for Isis and William? Okay, there will be other opportunities throughout the presentation and at the end. So at this point, we will move forward. And again, at any time, you can send us questions that you have. So right now, I will turn it over to Dr. Florsheim, who will discuss the Young Parenthood Program with us. He will discuss implementation efforts as well as lessons learned. So, sorry, one quick second. All right, Dr. Florsheim, you're able to speak now.
Okay, thank you. Thanks to Lisa and Teresa, and I really appreciate the invitation to join you and to talk about the Young Parenthood Program. And I also want to just say to Isis and William, I'm so impressed with how you were able to articulate your experience in a way that really is so much, in some ways, more sort of sophisticated than I'm going to approach co-parenting. I have a lot of material that I want to cover, but I think you really did a nice job of talking about how complex the co-parenting relationship is and the situations that you face, as well as really boiling it down to how simple the importance of it is. That it's really about the child, and it's really about your child's development, and that relationship being so important and just fundamental to their development. So you did a great job with that. I have a lot of slides to cover, and I do think that we're a little bit behind schedule, so I'm going to zip as quickly as I can through some of the materials, and I probably will skip a little bit of, or just kind of skim the surface of some of the slides. I am going to try to talk about the big picture. So I'm going to tell the story of how we arrived at the Young Parenthood Program. I'm going to try to touch upon a number of these factors that Lisa suggested that I touch upon. Some of them are sort of built into the presentation itself, so that the developmental focus and the inclusion of families and measurement, intimate partner violence, the implementation process, what we did well, what we were challenged by. These are the issues that I can speak kind of naturally about. Legal issues are kind of background issues that we've dealt with for a number of years, really since we started this. We've been confronted with the same sorts of legal issues that I'm sure the audience has been confronted with when working with young parents. And although many of, or not, maybe not many, but quite a number of the young parents who participated in the studies and the programs that we've developed and run have been in child welfare, have been child welfare involved. I don't have that particular focus in this presentation, so I'm really interested, and I hope that we have time at the end to hear from folks in the child welfare system about sort of how this all relates to the work that they do. You can skip to the next. So I'm going to start just with some of this background material about an interpersonal developmental focus or perspective on the transition to adulthood, and where does the co-parenting relationship fit in to that process of moving to adulthood for young parents in particular. The focus of my research has been on young parents. Obviously the background issues are the risk and protective factors that are related to interpersonal development, things such as depression and substance abuse, getting into trouble. All of these things can have an effect on dating relationships, on how the relationship unfolds across during the pregnancy and across the transition to parenthood. And then, of course, will affect the quality of both the parenting relationship as well as the co-parenting relationship once that child is born. And as I'm going to speak about in the next slide is the link between the quality of the co-parenting relationship and the child's functioning, something that both Isis and William touched upon in their own lives. We'll go to the next slide. So the way the quality of the co-parenting relationship affects the child's development and the child's functioning in two important ways. One, as Isis referred to, that their economic hardship can have a dramatic effect on the child's developmental context, so that when there are two parents, when there are two people working together to support that child financially, it decreases the economic hardship on the child. And then, of course, the opposite is also true, that when one parent is raising the child alone, the child is much more likely to be exposed to the difficulties of growing up in an economically disadvantaged context. It's also the case that when the child is exposed to parent conflict, to parent violence, it can have a dramatic effect on their development and their functioning. And so there are these risk factors, the ways in which there are risk factors affecting the child's functioning. But it's also the case, and I think that this too was touched upon by Isis and William, is that there's also the positive side of this too. So when the child is exposed to parent cooperation, parents caring for each other, parents both contributing to the financial stability of that child, the child is likely to experience a sense of wholeness, even if the family isn't together in a romantic, if the couple, the parents are not together romantically or not married, the child is more likely to experience their lives and their family more wholly than they would otherwise. You can go to the next slide. So this, I'm going to sort of go through the story of the Young Parenthood program, but I want to start by talking just briefly about what it is. And the way we conceive of this is as co-parenting education and counseling. So providing parents with the skills that they need to work together as co-parents, to resolve their relationship issues when relationship issues inevitably arise in a way that is constructive rather than destructive, and to focus on family stability with this idea that the extent to which they can create a stable family environment for their child, regardless, again, of whether or not they're together, it will have a positive impact on their child's development. And we make a very strong point in the beginning about that the program is not about marriage, because we work with, particularly with young people, we emphasize that we're neutral on the issue of marriage, that regardless of what happens to their relationship, these skills will be useful to them. You can go to the next slide. Oh, and then you got to click again. So one of the things that, I think back, or forward, I'm sorry. One of the issues that we have been confronted with for a number of years is why include fathers? People have asked us this question over and over again, and pointed out that for many people's perspectives, it's kind of a waste of time to include the fathers, because the fathers are going to be disengaged over time, and that they lack the skills and they lack the maturity to contribute much to the parenting the child's development or parenting. And while the evidence does suggest that young fathers are more likely to disengage over time, the response that we've had to that is that the exact reason why people are saying not to include fathers or not to focus on young fathers is exactly the reason that we want to help these fathers develop the skills, develop the perspective to be able to manage that co-parenting relationship and stay more positively engaged. You can go to the next slide. So much of the research that I discussed a minute ago on the link between the co-parenting relationship and child development really comes from work that was done with married adult couples. It raises the question: does the relationship between young parents matter? And this is a reasonable question. That we really struggled with for a few years in terms of trying to understand, does the relationship between young parents matter with respect to the child's development and the co-parent and the parenting relationship. So I'm going to spend a few minutes talking about the basic research that we did, and I'm going to go to the next slide. So the fundamental research that we did prior to developing the Young Parenthood program was to ask questions about whether the relationship mattered, and then what was it about that relationship that was important for us to focus on if we were going to develop a program. So one was, what prenatal risk factors predict the occurrence of violence between young parents when their child is 2 and beyond? And our findings indicated that, not surprisingly, past violence was a significant predictor of future violence. It's also the case that father's substance abuse at the prenatal phase was a predictor of couples violence. And when I say couples violence, I'm not just talking about young fathers being violent towards young mothers. It also was the case that young mothers were violent towards the young fathers, and they were violent with each other. And we didn't see high levels of violence in our sample, but we did see a pretty high prevalence of violence in the couples that we worked with. So about 30% had engaged in some form of partner violence. Others' conduct disorder was also a predictor at the prenatal phase of a predictor of violence. So conduct disorder meaning that they were getting into fights at school, they were engaging in illegal behaviors that got them into trouble with the law. And then finally, and this was the one that was in some ways most important to us, is that observed hostility during a conflict task, we videotaped and then coded couples interacting, was a predictor of violence two plus years later. And then on the other side of it is what prenatal protective factors predicted positive co-parenting relationships when the child was 2. And what we found was that the observed level of warmth between couples during that conflict task was a good predictor of how well they were getting along 2 plus years later. Now, neither of these things are, the risk factors and the protective factors might seem kind of obvious at this point, but at this stage of the game, we were really feeling as though we needed to demonstrate that the relationship did matter. You can go to the next slide. The second question, or the second question that we asked was, what prenatal risk factors predicted high child abuse potential among young parents when their child was 2. Now, this is not child abuse per se, but risk for child abuse. And what we found was that for the young mothers, poor relations with their own families and observed hostility towards the partner were significant predictors of higher levels of child abuse potential, both in their attitudes, the potential scores, as well as in their physically punitive behavior towards their child. For young fathers, it was a very similar story, except that it was poor relations with their parents and with the partner, as well as observed hostility with the partner that predicted higher levels of child abuse potential and higher levels of physically punitive behavior towards the child when that child was 2. And you can go to the next slide. So this led us to the development of the Young Parenthood Program. And the idea behind this was to intervene early, as ISIS, I think, suggested that it's really important to start early on during the pregnancy to help both young mothers and young fathers begin to develop their relationship and their relationship skills to prepare themselves for parenthood, and that the predictive model is that if we could facilitate their development, kind of speed up the developmental process so that they had the kinds of relationship skills that would, I mean, we don't expect that adolescents will have the kinds of relationship skills that allow for positive co-parenting. We, as many people in the audience probably will have experienced, that it's not an easy thing for adults to engage in co-parenting relationships, particularly when those relationships are rocky. We don't really expect adolescents to have the kinds of skills. And so, in a way, part of the idea behind the co-parenting program was to speed up development and to help them develop those skills so that they could have a better relationship, and that this would lead to a better adjustment for themselves, as William referred to, as they make that transition to adulthood, and a greater degree of father involvement. Go to the next slide. So I'm going to walk through the different phases of the Young Parenthood Program as we've developed it. The current version of the Young Parenthood Program has 6 phases. In some of the research that I'm going to be discussing, it actually only had 5 stages, but we added this sixth phase of the program as we learned from the process. The point of this slide is really to sort of give you, the audience, a sense that it is a manual. There is a protocol to this that we follow with some fidelity. It's intended to be a flexible program and tailored to the individual needs of couples, but it's also intended to be to follow a protocol so that it can be replicated in different contexts. You can go to the next slide. So I have not talked much about recruitment, and recruitment is a real challenge, and we'll get back to that at the end of the presentation. So we do when I first started doing this research, I was actually primarily interested in fathers, and learned pretty early on that the best way to recruit young fathers into research was to recruit the fathers through the pregnant mothers, the pregnant teen, through prenatal clinics. And so we learned from that. I got interested in the relationship as I got interested in hearing both the stories of the young mothers and fathers, and we feel as though this strategy of working with prenatal clinics, with schools that have services for pregnant and parenting teens, really works, and that it's the best way to engage the father by engaging the mother or the pregnant teen. What we do early in the process, once having recruited them into either the research and the program, is to focus on first the philosophy of the program, to explain what the goals of the program are. And what we briefly say
Paul, are you still with us?
Sorry, folks, we just had a little disruption, so we're going to just try to get Paul back online.
Hello? Hi.
Oh, yeah, sorry, there was a little bit of went down for a little bit, so sorry about that.
Okay, that was on your end, not on my end.
Okay.
Did you, so everything's okay now?
Yeah. Yes.
All right. Am I doing anything wrong?
No.
All right. Okay. All right. I'll continue. So one of the things that we do early on is to explain to the parents that their relationship with each other is, in some respects, the most important aspect of their child's world early on in their development, and the extent to which they can be supportive and caring is important to the child's earliest. Caring and supportive of each other will play an important role in the child's development of their sense of security, their ability to calm themselves, and the extent to which they can work together to stay engaged with each other regardless of what happens to their relationship will matter to their child in the long run. And there is no young person who doesn't understand the logic behind that. And so it's a pretty easy way to convince them of the value of this sort of program. We quickly move to talk about their goals and their parenting goals and their co-parenting goals, and this is a way of tailoring the program so that we can make it relevant to each couple. What we do with the goals is that we focus on their strengths and their areas of growth. We focus on the personal strengths and the relationship strengths, as well as the links between their personal strengths and goals and their relationship strengths and goals. And one of the challenges for people who are learning how to do this for the first time, for counselors that are learning how to do this the first time, is to really think about the couple as a couple rather than two sets of individuals. And so one of the things that we do very early on is explain to the couples that we as counselors are a counselor for their relationship, and we often speak from the perspective of their child rather than counselors for them as individuals. And so early on we get them talking with each other about their goals and sharing. Sometimes it can be very challenging for a young person to say, here are my parenting goals, or here are my strengths, and so we'll right away engage the partner in, well, can you tell me what you think his strengths are? And that gets a sort of a more three-way dialogue going in the couples counseling relationship. You can go to the next slide. Phase 3 is the interpersonal skill building phase, which is the longest and in some respects the most important phase in the Young Parenthood program. As you see here, there are 9 different skills or tools that we typically sort of pull out of our toolbox to work with different couples. We do not use all 9 with any couple. We tend to focus on 2 to 4 of these skills and tailor it to the particular needs of the couple. Some couples have a hard time expressing anything to each other, and sometimes some couples have a hard time shutting up and letting the other person talk. So that requires a very different type of approach depending on what their individual strengths and needs are. I'm going to talk a little bit about reflective listening on this next slide. So I'm going to give the example of reflective listening, which is a skill, a tool that we use with most of our couples for a couple of reasons. One is that it's easy to do. It's a good introductory skill. It's easy for for the counselor to engage couples around this, and the second is that it's kind of a feel-good skill in that most couples really enjoy having their partner really listen to them and repeat back what they learn from hearing them talk. And so this is something that is done in marital counseling all the time. And one of the things about the Young Parenthood program is that we borrowed a lot from the marital therapy literature, but then modified it for the context of adolescent co-parents and young co-parents who are not necessarily going to be staying together in a relationship. So the goal is to slow down and listen. And so what we do in this skill is to ask one partner, the speaker, to express feelings or points of view regarding a recent disagreement, and ask the other partner, the listener, to basically bite their tongue and allow the speaker to have their say without any interruption whatsoever, which can be difficult in the beginning. Then we ask the listener to repeat back verbatim what was heard, and this can be very difficult for some. They often get it completely wrong. Sometimes they get it quite right, but sometimes they hear things that are quite different from what the speaker said. The speaker then is asked to clarify the difference between what they said and what their partner heard until they get it right, and then they flip, and the listener becomes the speaker, and the speaker becomes the listener, and then we ask them at the end sort of how that felt, and almost without failure, couples feel as though it feels pretty good to have their partner really just listen and take it in what they said. This is a very useful skill for when conflict begins to heat up, and that couples are instructed and told that if they can slow it down and stop and listen and talk and using this type of exercise, they will be able to avoid conflicts from getting too hot. We're not trying to discourage conflicts because it's almost impossible to do it, but to change the way in which couples argue and fight. You can go to the next slide. The fourth phase is role transitions, and what we do during this phase is to focus the couple on how their roles in their lives and with their families, with their peers, and the quality of those relationships with their peers and their family will shift with parenthood, with this transition to parenthood. And one of the things that we do see, some of the conflict occurring around tensions within the family environment, the extended family environment, so with his parents or her parents, but also with the peer group. It's not unusual for young fathers to want to continue to sort of engage with their peer group in a way that sometimes frustrates the pregnant teen or the young mother, whose life is sometimes altered much more dramatically. And so some of the conflict is about shifting the nature of those peer group relations so that the father, as well as the mother, but it tends to be gendered with many of the couples that we work with, can hold on to some of their childhood, their adolescence, but at the same time adjust to this transition to parenthood. And what we do during this role transition is we typically ask the couple if they want to invite their family members in for a session so that they can work as a couple, together as a couple, regardless as to whether or not they're together as a romantic couple, to ask their extended family members for support. And that we emphasize that if they can do that, sometimes the young couples really feel discouraged about whether their parents, the grandparents of the baby, are going to treat them as adults. And what we like, the reason that we like to have the parents come in is that we believe if they can ask their parents for support in a respectful way and that the parents can begin to see them as young adults, that it shifts the dynamic of those relationships. It's actually, I want to point out that we, more often than not, do not get the couples to invite their parents in. They tend to not want the parents to come in. So we do develop a relationship with the extended family through phone calls and whatnot, but we rarely work directly with the families. We can go to the next slide. The fifth phase is in some ways the simplest, and the goal of this is really to acknowledge strengths and gains made throughout the program, to sort of consolidate what's been learned, to focus on reducing stress just prior to to childbirth, and to emphasize how they can support one another during this stressful period. It's not unusual. We've seen, fairly often that couples do experience more relationship conflict as they approach childbirth. They get more anxious about what comes next, and so we tend to try to tone things down a little bit. And then we discuss anticipated parenting issues or concerns that they may have as they reach this milestone. You can go to the next slide. And then in the phase 6, which is what we do now, is that we do a follow-up co-parenting, a couple of follow-up co-parenting sessions. And for some young parents, we focus a little bit on the parenting issues as well, in terms of teaching them to care and parent infants, particularly those young couples who are having the greatest struggle or may have less support from their extended family members around how to work as parents. What we tend to do during these follow-up sessions is really to just reinforce previously learned skills and to address somewhat briefly new issues and needs as appropriate. You can go to the next slide. So now I'm going to sort of shift and talk a little bit about the research that we did on the Young Parenthood program, and I'm going to talk about 2 studies. The first study, which we really consider as our pilot study, was done with young parents in Salt Lake City, Utah, where I was prior to moving to Milwaukee. And what we did was randomize couples into a treatment group where they received YPP and a control group where they received what we call treatment as usual, which for these young couples meant that they had access to all the other services that they might otherwise have, but they didn't have co-parenting counseling. We followed up. We did an assessment before the baby was born, during the pregnancy, and then post-test when the child was 6 months, and then again when the child was 18 months. You can go to the next slide. Our assessment strategy, as I said, involved 3 points in time before the baby was born, 6 months, and 18 months post-birth, with what I call time 1 and time 2. We administered essentially the same measures because what we were interested in was change over time to see whether those couples who participated in YP changed in positive ways because of their involvement in YPP. So we focused on the quality of their relationship with their parents and with their partners. We used observational techniques, as I alluded to before, video recording, and then coding their interpersonal behavior during these interaction tasks that we asked them to do. And what we focused on mostly was the level of warmth, the level of hostility, and the level of control in those relationships. We administered interviews where we had an interview-based approach to assessing relational competence in both the young mothers and the young fathers, and we defined relational competence by focusing on a number of these skills that relate to the skills that we developed in the session. So express warmth. How much are they able to express warmth and support for each other? How much are they able to empathize with each other? How much are they able to accept each other for who they are rather than try to be changing each other's behaviors? And how much do they see themselves as together, regardless of how they are as a romantic couple, that they are together as co-parents and committed to the co-parenting relationship? And these are things that we saw as being relevant both to co-parenting, but also skills that would be important for the parenting relationship. And then we also began to focus on intimate partner violence simply because we began to hear quite a bit about intimate partner violence that arose in the course of the interview. At follow-up, we focused on parenting and co-parenting. So we defined parenting in a lot of different ways, including father's level of involvement with the child, the parent behavior, so how nurturing they were with their children, how physically punitive they were with their children, and then what their child abuse potential was, what their attitudes and behaviors were that put them at risk for abusive behaviors. Co-parenting, we focused on the quality of their relationship with their partner and whether or not they were engaged in intimate partner violence at follow-up. You can go to the next slide. In the first study, what we found was that fathers who were randomized to the Young Parenthood program were more likely to remain positively engaged as co-parents and as parents with their child, so that they were more likely to report high-quality relationships with their partners. They were more likely to be more involved just in the day-to-day activities with their children, and to be more positively involved, both quantity-wise and quality-wise. They were found to be more positively involved. We found that this higher level of involvement amongst the young fathers was largely explained, mediated by their relational competence, which was related to the young mother's relational competence. So in some ways, the short story here is that fathers who were in the Young Parenthood program became more relationally competent, partly because of their relationship, the quality of their relationship with their partners, and that relational competence among young fathers translated into better relations with their children. You can go to the next slide. We were encouraged by these results and wanted to continue our research. We did note that there were a couple of things that needed to be revised about this first, about the Young Parenthood program at this point. One is that we heard from the counselors who were providing the Young Parenthood program that it was challenging for them to focus just on the relationship between the co-parenting partners, because there were so many other things going on in their lives, housing concerns, legal concerns, school-related concerns that were sometimes seemed more pressing and interfered with their ability to focus on their relationships. So we added a care coordination component to the YPP, which essentially meant that the Young Parenthood program counselor was now working with a case manager as a team to facilitate the development of these young couples. The other thing that we did is that we realized that primarily we realized when we were in Salt Lake City that we were excluding a lot of couples who were Spanish speaking. And so we wanted to provide the program in both Spanish and English, which required that we translate everything into Spanish. So we got into the business of cultural adaptation. And this is something that we really have learned to take more and more we've learned to include it as a primary focus in so much of what we do, because we really are invested in having the Young Parenthood program be adaptable for different cultures and different contexts. You can go to the next slide. So in the second study, we randomized couples into this treatment as usual control group, into a group that received both Young Parenthood program and care coordination, and then a third group that received care coordination only. We used the same assessment strategy that we used previously, prenatally, 6 months post-birth, and then 18 months post-birth, to follow up on how the young couple was doing as a couple, as well as how they were doing as parents. If you can skip to the next. There are two findings that I want to focus on for this presentation. The first is that couples in the Young Parenthood who were randomly selected with the Young Parenthood program plus the care coordination engaged in more warmth and less hostility over time than couples who were randomly selected into the care coordination only group or the control group. So as you can see, the observed warmth scores went up for the primary treatment group, the YPP group, and the observed hostility scores went down over time. These scores, the 0.295 and the negative 0.496, represent change scores over time. You can go to the next slide. Uh-oh, can you hear me? Next slide, please.
Is this the slide, the lessons learned, or?
Hello?
Yes, is the lessons learned slide? Yes. We're on the lessons learned slide. Is that what you were looking for? Okay. So we are experiencing technical difficulties again. At this time, if you can please submit some questions that you might have, and please send those in using the chat feature so that once Dr. Florsheim gets back on, he is wrapping up the presentation, we are ready to start the question and answer session. Okay, folks, I'm sorry about that. We are going to, in the interest of time, move forward. We do have a question. Okay. If this question is for Dr. Florsheim, we're going to actually ask that you hold that question until we can get him back on the line. So at this time, we're going to move forward to our peer-facilitated discussion. We've heard a lot of great information, and we hope that it has ignited your thinking on creating opportunities for expectant and parenting youth for this co-parenting approach. As we pull up the slides of a list of questions that we want to guide the conversation, I want to first start by asking Sabine Sherry, from the Assistant Commissioner from the New York City Administration for Children's Services, to talk with us a little bit about the co-parenting curriculum that they're currently developing and will be piloting next month. So if you can share with us, Sabine, some of the initial challenges and takeaways from your efforts to match and to recruit expectant and parenting mothers and fathers for this project.
Hi, good morning and good afternoon, everyone. Some of the challenges that we're facing, and we're going to be real honest about it, is we see there's a lack of trust, commitment, and the resources that we're working with as we're gathering and trying to better understand who our expectant and parenting youth are in New York City within our continuum of care, whether it's in family foster care or in our mother-child facilities. We found that really getting the buy-in, not only from the expectant and parenting youth about how do we work with them, but with the agencies, the case planners, and the social workers that we're engaging with, for them to really understand what our commitment is in Administration for Children's Services as our team specialists, and for them to understand that we're here to do a collaborative effort and partner with them. So the matching process was kind of difficult for us, and we're still learning because this is new to our jurisdiction, and I think we're the first that are really implementing co-parenting for our young expectant and parenting youth here in New York City. The young ladies really fear getting the young men in trouble, especially if the fathers of their children are older men, and they may think that if there's orders of protections that are in place, they don't want to get the young man in trouble, if there's going to be a child support issue that comes up. So they're kind of reluctant and resistant. So we're really trying to understand how to better engage them, and our team specialists are doing a good job in doing that. We know for our young mothers in care, the greatest challenge is really locating who the young men are. We serve a population of expectant and parenting youth of females known of about 326, but we don't know who our young fathers are in foster care. So little by little, we're making segue by engaging our providers in giving us that information and really using our Young Parents Speakers Bureau. You heard from Isis and William, who are helping us work with those young people in care.
Thank you, Sabine, for that. We do have Dr. Florsheim back online, and I just wanted to note that it is approaching 3 o'clock, and we do want to be respectful of people's time. We understand that there are other commitments and meetings. We will move forward with those that are able to move forward with us for about another 10 minutes, and we, again, do understand that if you have other commitments and you're not able to do so, we do understand that. So, Dr. Florsheim, I'm going to turn it back to you.
Well, and I will be extremely brief in my wrap-up and just say that one of the things, there are a couple of things that we sort of have learned from this and are wanting to continue to develop the program in a couple of different ways. What we learned is that you can engage young mothers and fathers together in co-parenting, and that the focus on prenatal period we really do see as a valuable window of opportunity for doing that. We also feel as though what we learned is that we need to tighten the program in some respects so that we can deliver it in a more condensed format so that it can be more effectively implemented in various social service agencies or prenatal clinics. It's a difficult thing for many programs to figure out how do we incorporate this type of thing into the services that we provide. We also feel as though it needs to be integrated with other types of services. So even though we have been focused almost exclusively on this co-parenting, we really don't see it as instead of the other important services such as parenting or economic stability support, as well as educational supports for young parents. So we really feel as though the best way to do this is to have a more integrated program. And I'll wrap it up at that.
We have a couple questions for you. So one of the questions that I'll be reading is, can you say a little bit more about the stronger effects on the fathers than the mothers in the findings from the study?
Yes, that is something that we initially were somewhat surprised by, and then we went back into the literature and thought about it a little bit and realized that it's not terribly surprising because I think Isis actually mentioned this, that that mothers have a fair amount of support starting during the prenatal phase and continuing through early child education programs and whatnot, that it's very mother-focused, and so it's easier to find because they're getting support from their families, from their extended families, from various agencies that they may be involved with, and fathers tend not to be getting that support. We actually think that it was easier to get effects with fathers because we were doing something that nobody else was doing. So it's sort of like, well, if you do anything that's helpful and supportive, you're going to see effects with these young fathers. We actually really want to see more effects with young mothers as well.
We have another question from Anthony David, and we are going to unmute you right now so that you can say your question. Go ahead, Anthony. Okay, we're going to move forward to the next question, and then we'll come back to you. So then we have another question from Susan Natkin, and we're going to unmute you.
Hi, can you hear me, Lisa?
Yes.
Hi, everybody. First of all, I wanted to thank Isis and William for a fabulous presentation, and also Paul. I thought it was really informative. I guess a question that I have, Paul, you talked about how important, how your program is based on starting to serve couples during the prenatal phase. I was wondering, Sabine, whether the New York City program starts postnatally or prenatally, and what was your thinking about whatever decision point you started at?
Right now it's going to be postnatally, but we're thinking eventually to do both in the future for prenatal.
Thanks, that's helpful. And Paul, do you have any advice to them on, combining it with a prenatal program, attention focus?
Yeah, I mean, I think that, one of the things, I mentioned just a minute ago sort of about the integration of co-parenting and parenting together, bundling those services, and that becomes particularly important with parents, with couples who are already parents. They're going to have a lot of questions about parenting. One of the reasons that we can focus so much on the co-parenting relationship during the prenatal period is that they don't, parenthood is hypothetical at that point, and so we're really sort of able to engage them around their relationship more fully. But that's more of a challenge. You're going to have to sort of go back and forth between parenting and co-parenting, which is probably what you were thinking anyway, I imagine. We are actually we're applying for some funding now where we would test this out with parents, expectant parents who are both co-parenting and parenting.
Great, thank you.
We have another question. Did you notice any difference in outcomes when the father was older than the mother?
We did not. We actually we did exclude fathers in different studies. We took different approaches to excluding fathers who were much older. So currently, we're running a study now where the father has to be no more than 5 years older than the young mother. In the first study, we actually allowed for up to 10 years older, but we didn't have any fathers who were that much older. So the average range of average difference in age was 2 years, which is pretty consistent with really any population of couples. And so because of that restricted range, we think that we didn't see any differences. If we were to be looser about those age restrictions, we wouldn't probably see a lot of, I think there's I think at least looking at the data that I've seen, there's more of there are certainly fathers who are much older, but they're in a small minority. So it would be interesting to focus on those fathers who are much older and see if there are differences. There may very well be. It may be a different sort of father who is much older than his partner.
Thank you very much for the response, and thank you for the very informative presentation, Dr. Florsheim. We are going to wrap up, unfortunately, due to time. There was a lot of great information that was shared, and we really want to keep the conversations going. We really want to continue to hear from you. The best way to keep these conversations going is by joining our Expectant and Parenting Youth and Foster Care Learning Collective, as well as our private Facebook group. Thank you again to all of our presenters. Following this webinar, you will receive a brief evaluation survey. We really appreciate your feedback on the webinar, as well as additional topics that you would like to address. This will really be helpful to us in our future planning. Also, I want to give a special thanks to CSSP, NE Casey Foundation, and special thanks for Teresa for helping manage all the technical aspects of the webinar.